Hello, I'm Christine Talley from the University of Minnesota School of Nursing. I will be sharing the results of a systematic literature review of qualitative studies that our team did to understand the experiences that family caregivers have providing incontinence care to their loved ones. This review was done without funding, and I have no affiliations to disclose. The global need for informal caregivers is rising. Worldwide, there are approximately 101 million people over the age of 60 that need assistance with activities of daily living. The majority of this care is provided by informal caregivers who are typically the spouse, adult child, or other relative or friend of the care recipient. In the United States, approximately 19% of informal caregivers are managing incontinence. Informal caregivers who have to manage incontinence experience greater caregiver burden, economic and emotional distress, and unhealthy behaviors. Care recipients with incontinence are also at a greater risk for institutionalization and for neglect and abuse from their caretakers. The World Health Organization recommends that general caregiver support programs include psychological intervention, skills training, and social support. However, evidence is scarce on how support programs can help caregivers manage incontinence. Understanding the perspectives and experiences of incontinence caregivers will help inform the development of support programs. Therefore, the purpose of this systematic literature review was to identify the perceptions, experiences, and consequences family caregivers have managing incontinence. This slide summarizes our systematic review methods. Eligible studies had to have a qualitative design. Study participants had to be an unpaid adult family member or friend providing care at home to an older person with urinary and/or fecal incontinence. We searched 6 bibliographic databases for English language peer-reviewed publications. We also used several tools from the Joanna Briggs Institute to appraise the study quality, rate the credibility of findings, and to synthesize the data. Our database searches yielded over 1,000 unique references, and we screened 112 full text documents, and ultimately, 7 articles met our eligibility criteria. The studies were conducted in 9 countries, and overall, there were 134 caregivers interviewed, the majority of who were female spouses of the care recipient. From the 7 eligible studies, 49 findings were extracted. Only the 35 findings that were rated as unequivocal or credible were eligible for the meta-aggregation. The meta-aggregation of study findings yielded 4 synthesized statements supported by 13 categories of finding. The 4 synthesized categories appear in the top row, and the supporting categories for each appear below. The 4 synthesized findings are summarized on this slide. The findings are consistent with the World Health Organization's recommendations to include psychological interventions, skills training, and support. It also calls attention to a few areas that may be unique to incontinence caregivers, including negative feelings associated with incontinence and changes in intimacy. The results of this systematic review provide information that can be used to develop caregiver support programs for managing incontinence. Intervention should be multi-component and tailored to meet the needs of caregivers and care recipients. Programs should include strategies to cope with emotional responses, alleviate financial burdens, activate social networks, provide respite, offer practical strategies for managing incontinence, and support positive emotional responses and coping.